Thank you for staying with us. Now, to speak to us on a rising vaccine preventable death, we already introduced Dr. Paul Ngwakum. He's UNICEF Regional Health Adviser for Eastern and Southern Africa. Thank you so much for joining us on the news, sir.
Thanks very much. Thank you for inviting me.
It's a pleasure. Now, Dr. Ngwakum, despite recent progress, over 30 million children remain under-vaccinated globally. What specific trends are you seeing in Eastern and Southern Africa?
Well, the data published recently, we note there has been some progress in Africa in general. But this data also highlights that there is still a very long way to go to be able to prevent populations from having vaccine-preventable disease outbreaks. In Eastern and Southern Africa, between 2024 and 2023, we've seen some progress. 15.5 million children got vaccinated in 2024 for the first dose of DPT against 15.4 in 2023. But that said, with population growth, we are also noticing there is stagnation in coverage. This increase in absolute numbers doesn't translate in increase in coverage. But if you take a disease like measles, there has been some improvements also from 56% coverage in 2023 to 60% coverage in 2024. But again, this will not stop us from having measles outbreaks. We need 95%. If you take a vaccine like HPV, we've also improved from 53% in 2023 to 59% in 2024. But again, we are not yet at the threshold to be able to prevent our adolescents from the risk of having cervical cancer. So in a nutshell, there is increase, but not where we can be able to say we can prevent disease outbreaks.
All right, Dr. Ngwakum, now how has conflict, displacement, or even population growth in these regions, or in this particular region, impacted vaccination coverage in the past year?
I think this is a very important question. And over the past years, conflict and rapid population growth has stretched the health systems and impacted vaccination of children. If you take, for example, places like Sudan, Somalia, or northern Mozambique, where you have conflict, this means populations don't have access to health services, and even the staff cannot access these populations, and putting them at risk because they cannot be vaccinated. Other things that bring about displacement, you have changing weather patterns, floods, cyclones, displacing populations, at the same time even destroying health facilities, which makes it impossible for vaccination to go on as planned. And rapid population growth also, I think you mentioned that. Population growth means resources have to grow with the same rhythm as population growth. Human resources has to follow. But you know the challenges we are having in terms of having money for the health sector. This doesn't go in the pace of the population growth, and we can't be able to meet the needs of vaccination. Those are the challenges.
All right. Now, Doctor, UNICEF has warned that, even small drops in immunization coverage can lead to large outbreaks. Now, what early warning signs or even outbreak hotspots are you monitoring right now?
Yeah, I think that's a very real warning, actually, because if you don't vaccinate, there's a big risk of these children getting outbreaks or getting diseases or getting sick and dying. And some of the signs or some of the hotspots that we are monitoring are the areas that we are having conflict. If you go to Somalia, for example, although Somalia has showed some progress in their vaccination, we have to continue monitoring very closely to ensure that we detect on time and to be able to respond on time to avert a catastrophic situation with an outbreak of measles or even polio. We have urban slums, informal settlements in many countries in Eastern and Southern Africa, and these are the places where we can easily get outbreaks because of the conditions, the hygienic conditions of the population. So we monitor these populations or these environments to ensure that we can be able to detect on time.
All right. Well, thank you so much, Dr. Ngwakum, for your time and for your expert's opinion on this.
Thank you very much.